What can go wrong during a hair transplant? Part 1. The procedure. Today's topic should interest anyone considering such a procedure. The list is longer than you think. That's why I divided it into two parts. We start with what can happen during the procedure itself. Hair transplantation is performed under local anesthesia. It is a safe medication, but it is not neutral for the body. Some patients may react atypically, dizziness, nausea, palpitations, and even an allergic reaction. Therefore, a medical consultation must take place before the procedure, not with an assistant or technician, but absolutely with a doctor. The doctor must know who is lying on the treatment chair and what health problems they have. This is the foundation of safety. During the procedure, bleeding occurs. This is normal. However, excessive bleeding is a serious problem. The most common cause? Blood-thinning medications or undiagnosed issues. An honest interview and examinations are key. Now, what depends on the hands of the doctor? The hair follicle is about 4 to 6 millimeters. The margin of error is essential. If we extract the follicle too deeply or at the wrong angle, the follicle will be cut in half. A damaged follicle will never produce hair again. Therefore, haste is not advisable. This is not a competition to see who can extract the hair faster. Precision is the most important thing. After the extraction, the follicle must be implanted. You need to grab the follicle by the epidermis, not by the bulb. Grabbing by the bulb is a death sentence for the hair. With a 6 millimeter margin, the margin of error is microscopic. There is one more stage that patients usually do not think about. Between the collection and the implantation, the follicles lie outside the patient's body, sometimes for several hours. During this time, they must survive in a special tissue preservation solution and at the appropriate temperature. If someone keeps them in inappropriate conditions, the hair follicles die. Quietly, without drama, but they die and will not produce hair. And the last stage, the actual implantation. If the follicle is inserted too shallowly, it will not receive adequate blood supply and will die. If implanted too deeply, the same. If the hairs are implanted at the wrong angle, they will grow in a strange direction and will not lay properly. And if implanted too sparsely, they will not provide the appropriate density. All of this may stem from a lack of experience, or worse, from the fact that the procedure is performed by someone without medical qualifications. And I'm not speaking theoretically here. The International Society of Hair Restoration Surgery regularly warns against facilities that perform procedures illegally, hiring technicians instead of doctors, meaning individuals who do not have medical education. Often these are random people. This was the first part, everything that can happen on the treatment chair. In the second part, I will tell you about what can happen after the procedure, because the procedure ends and the doctor's work is done. But the story of your new hair is just beginning.